I'm Justin Silverman of the New England First Amendment Coalition. Thank you for joining us for another 30-minute skills. For those of us joining us for the first time, welcome. These monthly lessons are a quick and efficient way to hone your reporting skills and build on your First Amendment knowledge. But they're also more than that. They're a way for you to reconnect with a community of journalists, researchers, attorneys, and academics who regularly attend these lessons. So to everyone, please use the chat to introduce yourself, showcase your own work, and connect with others. Also, make sure you register for our upcoming lessons on how to protect yourself online and how to begin audio reporting. Registration links can be found at nfac.org. As a reminder, links to previous 30-minute skills are available at nfac.org and on our YouTube channel, 5 Freedoms. Lessons include data cleaning, privacy law, Microsoft Excel basics, and how to diversify sources, among many other topics. Today's presentation is focused on how to develop a beat, and it's supported in part by the estate of Gloria Negri. Gloria was a trailblazing journalist at the Boston Globe for more than 50 years. This program is part of her legacy of newsroom education and her lifelong commitment to local journalism. You can learn more about Gloria and all of NEFAC supporters at nfac.org/supporters. We have a lot to cover and not a lot of time, so let's get started. Alexa, all yours.
I'm Alexa Gagosz, and I'm a business reporter out of the Boston Globe's Rhode Island Bureau. I'm focusing on everything from housing and homelessness, the business of food and restaurants, development, and healthcare. For a bit about myself, I've been working as a professional journalist for less than a decade. I graduated from grad school in 2020 in Boston in the middle of lockdown. And I thought I would be going off to Washington, D.C. to be covering politics in Congress. But instead, because of the pandemic, I applied to what seemed like almost 200 different journalism jobs across the country until the Providence Business News called me and offered me a reporting gig covering healthcare in the middle of a global pandemic. I moved to Rhode Island and started covering business, which are two things I definitely did not expect. I was in completely unknown territory. After 6 months of working in the business paper, I was laid off, and the Globe picked me up almost immediately to help them break news and expand coverage in Rhode Island. Because I was so new to the state and to the city, the beats that I was covering, I felt like I was really starting from scratch on everything. I had no institutional knowledge, I had zero sources, and I really didn't understand how small this state was. I'm still learning that every day. Everyone is within 2 to 3 degrees of separation. Justin, if you could just click the next slide. So when diving into something new, I tell everyone to read the coverage that already existed. Who has been quoted, who hasn't been quoted. If you're covering a business beat, go beyond the spokesperson. Ask to interview the CEO or executive director of a company or nonprofit, but then also get to know the C-suite members. Some of those folks are my most valuable sources who call me on a weekly basis. And you always want to find people who will be impacted. You're going to want to find the traditional data sources and reports, and then look at who wrote them. Ask to speak to the authors, who funded the report. Look at who is studying the beat you're working on locally, and then ask if they could be a source or expert for your coverage. Sometimes you're quoting them, sometimes you're just calling them up and saying, please help me understand how this all works. So here's just one example of this. When I moved to Rhode Island, one of the most important business and people stories that was about to break was that the Lifespan and Care New England, Rhode Island's 2 largest hospital systems in the state, were going to attempt to merge. If they were to be successful, they would have controlled about 80% of the hospital beds in the state, and they would have been Rhode Island's largest employer. Next slide. Executives were saying that they had to merge because of the financial pressures that they were facing in a state like Rhode Island where the reimbursement rates were low and because of the pandemic. But critics were saying that they were going to create a monopoly, that mergers rarely ever improved patient care and usually led to higher prices. At the same time, I was 22 years old. I had never before written anything about healthcare or health insurance for that matter. I didn't know anything about mergers or acquisitions. So again, I was really starting from zero. Like any big story, I really dove into the research first. I read anything that I could get my hands on about the hospitals. I requested to see their quarterly finance reports. I asked everyone why every other merger attempt had failed over the last 20 years. And I looked at the people who had already been quoted before and made a note that I should reach out to them, but then looked beyond that. To understand how mergers and acquisitions and healthcare administration all work, especially for someone who is young in my career, I contacted a professor at Providence College who taught a graduate seminar in hospital management, and this guy to this day is my lifesaver. I asked a lot of dumb questions, and in that first time that we ever spoke, it was not an interview. It was just me simply asking him, how can I understand this, and then put it in layman's terms for a general news audience? He practically sent me all of these readings for his entire graduate seminar. And I realized while going through the other coverage among other outlets locally, that this deal and the existing reporting was just not really breaking it down for a general news audience. People in Rhode Island were not gravitating toward hospital merger stories, and I can't really say that I blame them. They were not well read, but it was really because people genuinely didn't understand what the deal would mean, because it just wasn't being explained to them properly. They didn't understand how it would affect them. So I really started some of this coverage with the most basic information. And I was writing a lot of these simple explainers where I felt like I was almost interviewing myself and my sources, like 5 ways that the proposed merger could impact patients, for example, or impact prices. Another story was how this merger could impact employees, where I spoke to union leaders and frontline workers, the CEOs and observers about how this could impact healthcare and employment in Rhode Island. Next slide. In 2022, that deal was actually rejected by the Attorney General's office and the Federal Trade Commission due to how much market power this new entity would have if these systems actually merged. And actually, the FTC filed a lawsuit blocking any type of deal. So basically, the CEOs, after saying that they would be shutting down hospitals or they would be bleeding money, they were stopped completely by regulators from trying to merge together. So I covered all of this fallout, but it didn't mean that that story ended. These two systems have been telling Rhode Islanders that they were in so much financial trouble that they were going to lose, Women and Infants Hospital, which is where 80% of the babies in Rhode Island are born. That would have a huge impact. But even though this deal was blocked, none of these things happened. So I continued speaking to those CEOs constantly. Both of them eventually stepped down. Both of them were replaced by leaders from Boston. I did exit interviews with both, and I did intro interviews with both the CEOs. It doesn't mean that a story was written for every single one of those interviews, but it means that I was establishing a connection with each of these leaders for future coverage. In December of 2022, one of those CEOs was retiring, the one over from Care New England. And I had my exit interview with him on the very day that he was retiring. It was in the final 2 hours of his time at Care New England. And I figured that he would finally come clean with how he never believed that the health system was actually going to be able to merge. He would talk about some of the mistakes that he personally made or that the leaders made, and he would just be able to reflect on the future of healthcare in Rhode Island. So we did all that. But also, Dr. Fanale, who I've talked to so many times over the years, and really have made him into one of my own closest sources, let me in on a secret. He had been diagnosed with stage 4 lung cancer as someone who had never smoked before. And he didn't want anyone to know yet. So he pleaded with me, don't tell anyone. And I said to him, when you're ready to go public, give me a call. Next slide. And I'm just showing this as an example of why it's so important to stay in touch with your sources, even after you think that you won't have to contact them anymore. Obviously, that's a lot harder to do the more beats and sources you have. But months after Dr. Fanale and I spoke, it was just, actually, it was almost 2 years after we spoke, he reached out and he said he was ready to go public with his diagnosis. He wanted to know the world, he wanted the world to know that he was dying. And this story was really a scoop, but it was a story about, not just a human story about a man who had a lot of power at one point in the state, but he was ready to talk about life and what he was going through. And it shows that me as a reporter on this beat not only developed this source from a hospital CEO, a powerful man in the state who kind of held the power of employment and healthcare in his palm, but really somebody who did not always like my reporting at all was able to allow me to share his personal story with the world for the first time. And this kind of reporting really pays off because that was the #1 piece on the Globe's website that week. Next slide. When it comes to driving coverage, this is my personal favorite. I don't want to ever follow anyone on a story. I don't care how small or large it is. I don't want to follow anyone. I like getting exclusives. I like driving the coverage and conversation. I prefer to be proactive in a lot of the stories that I'm doing instead of just reacting to breaking news like a lot of other reporters are doing at that point in time. But in order to do this, you have to get organized. I have learned this the hard way so many times. So you want to start putting alerts in your calendar today about anything that's coming up. If you cover politics, you want to put in the deadlines for campaign finance reports, the deadline for when they come out. You want to put in deadlines for when the candidates file with election clerks and any other notable dates. It doesn't mean that there's a story for every time your calendar is pinging a notification at you, but it just means that you're on top of everything in case something squirrely goes on. So, and if you're covering business and you're looking into a regulatory issue, like such as the hospital merger I was just talking about, then you want to put it on your calendar for different dates and deadlines that the businesses have to meet, as well as the regulators to when they issue a decision. You just want to be on top of everything so that you're checking in with folks and saying, how's that going? Are you even close to filing that application yet? What's next? If there's a report that comes out annually, like the crime stats filed by the FBI that you have to cover, put it on your calendar for that week or that month every single year going forward. So you don't even have to think about it. You just know that it's coming up. If there's a big development that you're looking into or want to start covering real estate, you want to make sure that you're going to your capital city's planning board meetings and just put them on the calendar. It doesn't mean you're writing a story about the meeting minutes of that planning board meeting, but it just gets you in the habit of attending and understanding what kind of developments are being proposed, and then also putting you in the room with those developers, with their attorneys, so that you can be, the regular face on who's covering this beat. You don't want to be following another news outlet or TV station just because they got there in person and you didn't because it slipped your mind or you're just late to the party. So I really, really am a proponent of building out a calendar over the course of the next year. You want to always be several months ahead. You also want to find the holes in the coverage that currently exist. So if I write a breaking news story, I read my story and then I compare it to what other outlets are already writing. I look at what population or topic or even location that isn't being covered. You just want to be more proactive instead of reactive to everything. Next slide. Here's just one example of that. In December of 2022, there was a homeless encampment that was built on the Rhode Island State House steps. And the governor's staff handed out eviction notices to all the people who were sleeping or staying out on the plaza. But I knew that we had a homeless Bill of Rights in Rhode Island, and I wondered if the governor what he was doing was actually legal or not. So I wrote a story asking that very question, interviewing different lawyers in Rhode Island, but also everywhere else, trying to gain a perspective on what else was going on in the United States, what other cases are out there. There's been obviously so many homeless encampments that have been either destroyed before or they've been evicted from the campsite. So I just wanted to see was this legal on the State House grounds, which is technically the people's house. It's supposed to be a place for the public. And then when there was a lawsuit that followed that story, I covered that aggressively too. Next slide. Another example of that, there was a tenant union that was formed in Cranston, Rhode Island recently due to what the tenants were calling just absolutely horrendous conditions. The tenants were currently in a battle with their landlord. They went to court, but I went just beyond that with that property instead of tenants. And I wrote this enterprise piece last month where I looked at the growth of tenant unions across New England and showed how they found success in states like Connecticut for the most part. But in Rhode Island, I uncovered how there was nothing in the law that actually forced landlords to work with tenant unions. I interviewed landlords about their feelings about these tenant unions. I looked at the hystory of tenant unions in Rhode Island, both in public and private housing, etc. So I really looked at this one development, and instead of hyper localizing it even more, I just broadened the story to the entire region, and it honestly worked. It was kind of a hit, but also educated me and educated the readers. And then I would also just say that to get in the habit of asking sources to give you the exclusives and scoops all the time. It doesn't mean that it's going to happen or that they're going to agree to it. But if a source says or knows that, say Alexa Gagosz from the Boston Globe will not cover this one topic or will not cover the press conference that you're scheduling, unless you give them some type of exclusive or you allow them to interview the CEO or the governor a whole day ahead, then you're really driving that conversation. People can know, readers can know that you're going to have it first. So in this slide that we're on right now is actually an example of how I kind of have driven this housing coverage in Rhode Island. Frankly speaking, I am definitely one of the youngest reporters in the market, definitely one of the youngest at the Globe other than our interns. And for a long time, I kind of had this chip on my shoulder and used it to my advantage. The reason why I've been pretty successful in covering homelessness and housing is because for a long time, I was the only reporter willing to go where no one else was. And I mean, these are not sexy places. They are homeless encampments where I'm carrying Narcan around. I'm going into homeless shelters. I'm going into like seedy motels just to talk to anyone and everyone. And one of those places was called Operation Hunker Down, which you see this picture here. It was a makeshift homeless shelter in an old Lithuanian social club. So I basically just kind of not invited myself. The volunteers who had built it had said, come on down and take a look at this place. And I, instead of just going and interviewing a couple of people and then posting a story the very next day, I had embedded myself into the shelter with a photographer for an entire week. And I kind of acted as like a fly on the wall of this shelter for several days, every day, go in the morning, stay all day. I would stay into the night, one time overnight. And my photographer and I basically had this feeling that it was almost like mass and Cass, but inside. And for those who don't know what mass and Cass are, it's a like known as methadone mile in Boston. It's just where a lot of social services are. It's also where methadone clinics are. A large concentration of them are up in Boston. But here in Rhode Island, it was like we were just seeing so much fentanyl use in Operation Hunker Down in the social club. There were a lot of people who were also working full time, but they were unfortunately homeless because they were getting priced out of wherever they lived. So we really just documented that place. And after a week of being there, I published two stories. One was about how these private citizens, volunteers who built this Operation Hunker Down, who literally knew nothing about being homeless or were in positions of power of any kind, took the matter into their own hands and provided a space where they could, for dozens of unhoused people in Rhode Island during like the coldest months of the year. And that sounds like the novelty story of Good Samaritans, the way that I'm kind of describing it, but it was an accountability story that truly showed that Rhode Island had the realities of what being homelessness is and how it wasn't going away. And frankly, how some thought that the government was actually not putting enough funding or resources toward the problem, which was growing. The second story, which we published that same day, were vignettes of different people. I profiled volunteers and the people who were staying there about why they were there and their journey into homelessness. So that man in the picture is Michael. He's a veteran who did several tours over the years, and he battled alcoholism due to PTSD. And we wrote that story. And I heard from readers that it almost just clicked for them, like why some people end up on the streets. And that was just one story of many. Next slide. And then over Labor Day weekend of 2022, I met this family in a Motel 6 in Warwick. It was two parents and their four young kids. Both parents worked. They made $80,000 the year before, and yet they were homeless and cramped into this really crappy motel that was riddled with crime and drugs. And, they were just kind of terrified about being there. And they allowed me to start following their life with a photographer, where I documented how they were evicted from their apartment at no fault of their own, and then spent the next year spending tens of thousands of dollars on hotel stays, thousands of dollars in application fees for apartments, and were just trying to do their best to raise their children. And we showed how they went from Motel 6 to sleeping outside. For months, they had been calling the state's hotline, asking for shelter space for their family. And they kept getting told that they would not qualify to be put at the top of the priority list for family shelter unless they were literally sleeping outside or in their cars. So they didn't have a car, so they did exactly what they were told, and they got some tents and they went out into the middle of the woods and slept with their kids outside. They never actually qualified for shelter. And that's what that story really looked at, was how this family, two working parents, $80,000 in income, can still end up homeless. And I think that this story really just hit not only Rhode Islanders, but it hit a lot of Americans, because I heard from them all about, how they never expected that anyone could end up homeless. They saw themselves in this family and they said, this could be me. And a few months after the story published, the Speaker of the House here in Rhode Island called for a press conference, and he unveiled his housing legislation package, where he actually gave credit to me, to the Boston Globe, but to the Strong family, about why he was introducing a bill that would ban apartment application fees in Rhode Island for good. And he said that there's no reason why a family should spend thousands of dollars in a year to try to find an apartment by filling out these applications, but still have nowhere to go. The Strong family, who I'm still in touch with, they actually testified in support of that bill while they were still homeless and couch surfing with their kids. They couldn't afford childcare, so all of their children were in tow, and I was covering the whole thing. That bill passed unanimously, and a GoFundMe was put together by Globe readers and raised like $60,000 for that family. But I just kind of continued telling that story, and that story solidified like me being an authoritative voice on this beat. Next slide. Using social media is just so incredibly important. I think I use it to cover just about anything and everything. I'm obviously tracking down sources on social media like any of you are. You're finding them, messaging them on any platform that you can. But sometimes I'm also just simply sharing a thread on Twitter about my story and breaking it down over 2 to 3 tweets to try to explain what the story is about, so it kind of gets them to click on it and read it. I have my colleagues share it, but then people are just naturally interacting with you, like, oh my gosh, I can't believe that's the case, or oh, I have a similar story to that. So I also just get in the habit of just asking people questions on social media, whether it's on Twitter in a single tweet, or on an Instagram story, or in a neighborhood Facebook group, or even on Reddit. One example, Rhode Island's marketing campaign recently had these life-size stuffies, which are stuffed clams, be created and put in airports all around the country to kind of boost their tourism. And I thought that they looked interesting, to say the least. And I asked Rhode Islanders what they thought of these stuffies, just right on Reddit, right on Twitter, right in Facebook. And I said, let me know all your thoughts. I want to hear if you love them or hate them and why. And said, let me know by messaging me or emailing me, and posted it everywhere. And I think it took like an hour to be flooded with messages. And we posted that story within an hour of me putting out that call on a Friday before a long weekend, when I know that everyone realizes that readership is usually like way down unless something insane happens. And it was just this hilarious story full of these quotes about what everyday Rhode Islanders thought of this like ridiculous marketing campaign. And it was one of the most read stories of the week, which was absolutely ridiculous. It has nothing to do with my average beats, but it was just a fun story with a play on business, and a play on just like what everyday people have to say. So the last thing that I'll just say is, like, while covering all of these enterprise stories on housing and healthcare, I also launched the entire food and dining section in Rhode Island for the Boston Globe. And restaurants are just so critical in Rhode Island. The food scene, the food system in the state is just so vast and impressive that coming out of COVID, I thought that it needed to be covered in a different way, thinking more innovative. So we launched this newsletter that I am the author of, called The Food Club. I do different Q&As with chefs. I'm still breaking news in a different way, like who's buying that new popular restaurant, or who's opening the next great spot, or what have you. So I'm still like taking everything that I usually do from my business, reporting it, and just really translating that into restaurants. So I've kind of become this restaurant reporter by accident as well. But something that has been really helpful in developing my restaurant coverage is honestly going exactly to where my sources are on social media. And that's not just like in restaurants, but it's really on Instagram. I have like 4,000 followers, which is nothing in the grand scheme of things. But that's where all of my sources kind of live. It's the business owners, it's the chefs, it's the bartenders, it's the people with their ears on the ground. And I'm constantly posting things on my story like, where are the new restaurants opening? Or I'm sharing my stories on there, or I'm messaging back and forth with the bartender. And that's honestly how people have gotten to know me. They've gotten to know my work. And now they're reaching out to me and saying, hey, I'm planning on doing this. Or, hey, we're getting rid of our tipping model. This just happened last week. And we're getting rid of our tipping model. We're raising our prices. And this is why. And it's just kind of like an interesting food story that fits into the broader conversation over like the same topics that national restaurant reporters are covering. So like, even though I don't have this massive following on social media, I'm able to kind of just target my audience, see where they are, and then connect with them right there. If I need to connect with people on Reddit, it's usually where I'm sharing like the housing and homelessness coverage. I'm sharing the development stories because people have a lot to say about development in Rhode Island and in Providence and in like some of the suburbs. So any of like my wacky or very emotional gripping stories, they can go all to Reddit. So it's just like really meeting your audience where they are at this point. Next slide. Or that should be it, actually, Justin. So I just really appreciate you all for listening. I feel like I just threw so much at everyone while trying to show a few examples. I did list my email on there, so I'm always happy to chat if people want to reach out, but hopefully I can take a couple questions.
Yeah, thank you, Alexa. You did throw a lot out there, but a lot of really great stuff that I think is going to be very helpful to us all. So one question, how do you connect with people outside of social media and how do you show up in those spaces? What are some places to frequent, to meet people in the community and to develop potential sources?
Sure. So because I cover development and real estate, I go to like every single Providence planning board meeting you can imagine. And again, it doesn't mean that a story is coming out of it. It just means that those developers and those attorneys and those architects, they know who I am. And when they have something really interesting, like they want to, this is not true, but like just as an example, if they want to tear down the Superman building in Providence and then put some other skyrise up there, they know who to call. So that's one thing. I don't tend to go to city council because I don't cover politics like that anymore. But I will meet anyone for coffee. So what I typically do is if there's someone who's kind of like known as a thought leader in the state that I haven't met yet, or that I've heard about that I should connect with, I just kind of reach out to them cold calling and say, hey, we should meet for coffee. And I can always say like, I'm willing to meet off the record just for coffee. Like, let's just talk about what you do, your job. You can get to know me. That establishes a little bit of trust and a relationship between your source and yourself as a reporter that is only going to be beneficial in the end. So I try to show my face to everything, whether it's press conferences, planning board meetings, etc. But also just I cold call people. I reach out to people and say, hey, we haven't met yet. Let's go grab a cup of Joe.
Great advice. Got another question here along the line of sourcing as well. You mentioned earlier in the presentation your reliance on experts to quickly get educated about a particular topic. How do you find those experts? How do you determine who has the most knowledge on a specific topic that you're reporting on and where you can find them?
Yeah, I mean, I definitely don't just rely on like one expert per story or per issue, per beat, per topic. I am relying on so many different people. Sometimes it's really just a quick Google search about like looking for law professors who specialize in real estate law or something. Or when it comes to hospital management, healthcare management in New England, we have a plethora of universities who focus on this. There's a lot of research centers that focus on this, so it's really easy to find those folks. Sometimes you are reaching out to like the media relations person at various universities asking, hey, do you have an expert in this? I'm just looking to like try to understand something, or I'm looking for somebody who I could quote in this story. But also I do look at medical journals, or I will look at research papers on housing, and I will reach out to the authors and say, hey, what did you look into? How did you find this data? Can you help me break this down? Can I quote you on this? So it's really any way, anywhere, anyhow that I try to find these sources.
Great. One last question before we wrap up, Alexa. Appreciate your time. Um, do you have any advice or quick resources for those that are not only trying to develop a new beat, but are entirely new to a specific area? Maybe they've gone from Rhode Island, Providence to Boston, or now they're up in Manchester or Portland. They've got an entirely new community that they're covering. Where do they start?
Oh my gosh, I know this way too well. Go in person everywhere, go on nice long walks when you're not working or when you're on your lunch break, just to get to know the area. Go to any little tiny stupid public meeting you can imagine, just to get to know the players and the people. Dig into the archives of, the news outlet that you're working for, whether it's the TV station or the paper that you're working for. Look at the competition, look at what they're covering, look at what they're not covering, and ask your older colleagues who have been there for a really long time about where they see the holes. Hey, where have we not invested? What beats has no one looked at? Or, hey, I'm taking on this new beat and I know nothing about it. Do you know who covered it before me? And then maybe even reach out to that reporter. I have done that, and trust me, it was so useful. So just be anywhere, be willing to do anything, no matter how small or large the story is, and find the gaps, because there are so many gaps in news coverage, even in New England, where there's a plethora of outlets. And trust me, you can find them even in a beat that is well covered. So that's the biggest advice that I would say.
Thank you. And thank you so much for your time today, Alexa. Appreciate this lesson, all this advice and guidance. Great stuff. And to everyone who joined us, many thanks to all of you. We provide these lessons as a public service every single month. So please return the favor and encourage your colleagues and friends to join us. We have a lot to learn from each other, and I look forward to seeing you all again. On behalf of NEFAC, thank you for all you do, and we'll see you next month for our next 30-minute skills. Bye now.
Thanks all.